If you feel aches all over your body, you are not alone. This is one of the most common complaints people tell doctors. But the truth is that this phrase can mean very different things from one person to another. Sometimes the cause is simple and temporary, such as a viral infection, poor sleep, psychological stress. At other times, it may be the beginning of an important medical problem that requires proper examination, structured evaluation, and treatment. That is why in this video, I would like to explain the topic from the beginning to the end. What exactly does aches all over the body mean? What are the possible causes? When should we worry? And what should we do if we have this sensation? I'm Dr. Hatem Eleishi, Professor of Rheumatology in Egypt. Let's begin. The first very important point that must be said is that aches all over is a symptom, not a diagnosis. That means you cannot simply ask, what is the treatment for this aches all over? You should ask, what is the cause? Treatment is given for a diagnosis, not for a symptom whose cause has not yet been identified. Now, let us move to the most important causes of aches all over in the body. The first common cause is infection. A viral infection, for example. When you get a cold or influenza, do you not feel general aches and heaviness throughout the body? Usually, this is accompanied by fever, chills, sore throat, or cough. These generalized aches usually last a few days and disappear completely once the cold resolves. This is the first cause. The second common cause is exhaustion, poor sleep, and psychological stress. Many people underestimate this point. The body simply does not function well when sleep is poor. Pain sensitivity increases, fatigue increases, muscles tighten, and small ordinary aches become much louder. Some patients become convinced that they have a dangerous rheumatic disease, while the real cause is a mixture of poor sleep, emotional stress, lack of psychological conditioning, and chronic muscle tension. This does not mean, of course, that the pain you feel is imaginary. The pain is real, but it is not something dangerous at all. The third important cause is fibromyalgia, in which there is chronic pain throughout the body, especially in the muscles and soft tissues. This condition is very important in rheumatology because it is common and frequently misunderstood. Fibromyalgia causes pain in many areas of the body, along with sleep disturbance, problems with memory, general stiffness, or joint discomfort. Also, difficulty concentrating and increased sensitivity to touch or pressure. Patients may also have headaches, digestive problems, or anxiety. The key idea is that the nervous system itself becomes more sensitive to pain signals. This means that the body is not necessarily inflamed or damaged everywhere, but rather the nerves, you can say the electric signaling wires in the body, become overly reactive and keep sending pain signals repeatedly from many places in the body at the same time. Now, the fourth cause is inflammatory autoimmune rheumatic diseases. These include conditions such as rheumatoid arthritis, systemic lupus, inflammatory muscle disease, and some autoimmune spinal conditions such as ankylosing spondylitis. In reality, the pain in these diseases is usually more localized rather than truly affecting the entire body. For example, the complaint may be pain in specific joints or tendons, but when many joints are involved, the patient may describe the problem as pain everywhere and say that there is not a single part of the body that feels normal. In such cases, there are usually additional clues typical of the autoimmune disease. This may include impressive morning stiffness in affected joints, joint swelling, sometimes skin rash or mouth ulcers, muscle weakness, significant weight loss, and changes in certain blood tests. There is also a condition called polymyalgia rheumatica, which occurs in people over the age of 50. It is one of the classic examples of an autoimmune inflammatory condition that causes aches all over, everywhere in the body. Why? Because it affects the neck and the shoulders that radiate into the arm, as well as the lower back and the hips that radiate into the entire lower limbs and legs, which essentially means this is all of the body already. In this disease, patients often develop severe pain in these areas, especially when turning in bed at night, along with severe morning stiffness. These are characteristic features of the condition. Sometimes a patient may actually have inflammatory arthritis, which is the fourth cause, which we are discussing now, and also have fibromyalgia at the same time, because fibromyalgia can coexist with a list of autoimmune diseases. In that situation, the patient may experience a mixture of symptoms coming from both conditions. Now, cause number 5. This includes a group of additional problems that we can gather together here. This may include hormonal problems, such as thyroid disorders, or side effects of certain medications. This is why reviewing the medications that a patient takes is very important when someone is complaining of generalized back pain and we want to sort out if this medicine is related or not. When did you start to take the medicine? Did they start before or after the medicine? This is the most important here to sort out. Another possibility here is the problem may actually be related to the nerves. In that situation, the main symptoms may be burning, numbness, tingling, or electric shock sensations. The underlying cause may turn out to be peripheral neuropathy, inflammation of the nerves, for example, due to long-standing diabetes or vitamin B deficiency. But if the symptoms are burning or numbness and they are not caused by nerve inflammation, then we must again consider the other causes we just mentioned, like poor sleep or psychological stress or fibromyalgia. So what should you do if you have aches all over in your body? First, you don't need to panic, but at the same time, do not ignore the problem completely. Second, try to analyze the pattern of pain. Is it mainly in the muscles or the joints? Is there swelling suggesting an autoimmune disease? Is there morning stiffness? Do you have symptoms of a cold suggesting a temporary viral infection and that's it? Is your sleep poor and your daily routine disrupted, suggesting that improving sleep alone may help? Is there significant psychological stress that might require a break or a change of environment from time to time? Is there real muscle weakness, suggesting inflammatory muscle disease? Does the pain worsen with activity or with rest? Is there difficulty with memory or concentration, which may sometimes be seen in fibromyalgia? Is there dryness of the mouth, which can occur in some autoimmune diseases or in fibromyalgia? Are you taking medications that might be responsible? So think about those symptoms, additional symptoms, so that you can help your doctor to diagnose your condition. Third, should you move or stay in bed? Even though I do not know your exact diagnosis, in general, movement within the limits of pain and without pushing yourself excessively is usually better than complete rest in cases of chronic widespread pain. But movement should be gradual and reasonable. Some patients stop moving entirely out of fear of pain, while others exert themselves heavily on a good day and then collapse afterward the second day. The best approach is usually simple, regular activity that increases gradually. Fourth, you can read on the internet to obtain information, but do so carefully. Google can be ruthless. It often focuses on the most catastrophic possibilities and can ruin your day unnecessarily. In summary, pain everywhere in the body is a common symptom. You are not alone. It is not a diagnosis for which we immediately prescribe a treatment plan. It is a complaint for which we must find a cause. In other words, a diagnosis and then treat accordingly. The causes of generalized body aches are numerous, as we explained, and most of them are not dangerous.